Thanks, Iqbal, and thanks to everyone who's made this conference possible. I wanted three main things in this session. I think since the main theme of this conference in some sense is the connection of research and policy and trying to bring these two worlds together, the traditional divide is that researchers care about getting very, very careful, accurate answers to well-defined questions, but don't think about issues of implementation, or the standard criticism you hear of researchers, that's all wonderful in theory, but how does this work in practice? And so we hope that this session will prove an example of best practice in specifically this area. And so there's three things I want to talk about. First is just provide some global evidence on deworming along the lines we talked about today in terms of rigorous impact evaluation, as well as drawing on long-term historical evidence. And then the second thing I want to talk about is a very impressive infrastructure that's been built up by the government of Andhra Pradesh over the past 5 years to do rigorous impact evaluations in education, supported by the Azim Premji Foundation, the World Bank, and DFID, whose representatives are here. And then finally, we'll put those pieces together and talk about the specific initiative in Andhra Pradesh that combines scaling up of deworming along with impact evaluation in the AP context. So very quickly, the background on worms is, it's not one of those health problems that gets a lot of attention. The attention is always hogged by topics like HIV, but worms are minor, but are small things, but they cause a lot of problems. Among the most widespread diseases in less developed countries in the world, around 400 million children are believed to be infected with worms around the world, and particularly prevalent among school-age children. Now, there's a lot of medical studies that have shown that the effects of deworming on health are pretty substantial, but less studies showing the impact on education. And one of the themes we'll come back to today is this connection between health and education. And in particular, the case for doing mass health interventions at the school level, there are two very important things. One of which draws exactly on what Rachel did. So you solve that problem by bringing the last mile to the node. And that's exactly what would happen in this case if you were to use the school as the focal point for your healthcare delivery. And the second reason why school-based health interventions can be particularly effective is because there's much higher returns than just the treatment to the individual kid, but there's also returns to untreated kids and to the environment because you're reducing the transmission rates of infection. And both of these things are something that the evidence will show. So specifically, the project that's referred to and the paper cited in your brochure, this has been probably one of the most influential studies done in development economics in the past 5 or 6 years in terms of translating research into policy. So the idea is actually very simple. Kids have worms, let's deworm the kids and let's see whether that improves health and education outcomes. It's not rocket science at all. But the key to how the study was done and why it's been so credible is the random assignment that was done in the impact evaluation. So the study was done in about 75 primary schools in Kenya, phased in over 3 years and covering a total of about 30,000 pupils. And the key is that, so the treatment itself is twice yearly deworming treatments. There's 25 schools in each group, and the key idea is that the groups got phased into the program. So group 1 got it in year 1, 25 schools in year 2, 25 schools in year 3. And the medical baseline indicated that almost 92% of kids had some form of worm infection or the other, hookworms, roundworms, schistosomiasis, and a whole range of worms. So just a very simple, just a very, very, very simple diagrammatic scheme out of what this rollout looked like. So if you have a universe of 75 schools that could be in the study, the key is that the 25 schools in each of those 3 phases are chosen by lottery. And this is the theme about the randomized evaluation that you've been hearing about today. And why is this so important? This is so important because the randomization ensures that any difference that you see between these groups is purely as a result of this particular program. So let me give you a simple example. If you look at the midday meal program, that's been probably the biggest investment in school education in the past 5 years. If today I were to ask any of you what has been the impact of this program on outcomes, the answer is we don't really know. I mean, for starters, the outcomes were not defined clearly. So even if you were to think of outcomes saying nutrition, attendance, learning outcomes, we didn't necessarily collect baseline data properly before the program was launched. Now, even if you were to collect the baseline data in 2003 and say 5 years later, this is the improvement, aha, the midday meal program has had such a wonderful impact. The problem is that thousands of other things are changing at the same time, right? So you have general income growth, you have parents are getting more interested in education, attitudes are changing, tastes are changing, changing. So how do you net out any of these factors? And so it turns out that one of the hardest problems in empirical social science is how do I isolate the causal impact of any one particular program. So you'll hear this again and again, but the key point about the randomized evaluation is that all else is the same in both the treatment and the control groups. So the attitudes, the incomes, the tastes, everything else I talked about, on average are going to be the same. And so the only difference between these groups is this particular treatment, which in this case was the deworming program. And the phase-out model is something that's particularly attractive in the context of policy-based impact evaluations, because administrative concerns mean that it's almost impossible to say, here's a new program, let's roll this out to 80 million people in Bihar. Like, it doesn't happen in that speed, it's just difficult. So in this particular context, you'll see that after phase 1, you can compare group 1 versus group 2 and group 3, and that gives you the impact of this program on those kids. And after phase 2, in phase 2, what has happened? At the end of phase 2, the first group has had 2 years of treatment. The second group has had 1 year of treatment, right? So if you compare group 1 versus group 3, that gives you the 2-year impact of the program. And if you compare group 2 versus group 3, that gives you the 1-year impact of the program. So it's remarkably simple. And if done well, it's very, very clear to explain to policymakers or explain to the finance ministry as to why they should increase the allocation for this program if in fact it turns out to be highly effective. And by the same token, since Mr. Subramanian was now in finance, it also helps to identify programs that sound good in theory but in practice don't work. So in many ways, it's almost as important to identify those programs and make sure you're not continuing to fund programs that are not showing impact. So the summary of the program impact here was positive health effects, much lower worm prevalence in the treatment schools, 27% versus 52%, better height for age, and better self-reported health status. Positive impacts on education. Baseline student absence was 30%, and student attendance improved by almost a quarter. And there were large spillover benefits. And so this is the point about even children who were not treated, so children who were absent on the day the program was administered, even those children benefited substantially. Why? Because the infection rate had come down in their peers, and so the transmission rate had come down. And by the same token, there were also benefits for children in neighboring schools who in fact were not treated by the program. And the final thing, and this is I think the graph that Iqbal was showing at the very beginning, is that what makes this experiment so powerful is not just that it was one experiment, but that it was one in a series of experiments in exactly the same institutional context in Kenya. So what they were able to do was not just say deworming works, but how effective, how cost effective is it relative to other uses for the same money. And what they found was that deworming was by far the most cost effective way of increasing school participation relative to other programs like school meals, school uniforms, and girls' scholarships. And in fact, we heard yesterday the Principal Secretary mentioning about some of the schemes that had been successfully run by the government of Bihar. And I have no doubt that the cycle scheme, the uniform scheme, that these were successful. But what you don't know is whether there was something else that could have been more successful for the same amount of money. And so that's what this kind of systematic research program lets you do by comparing these various options against each other. Now, I'm going to take 1 minute here to kind of take a step back and say that you don't only get evidence from randomized trials, and in particularly for topics like public health, it's useful to look at long-term evidence from developed countries back when they were developing countries. And this turns out to be a particularly compelling case where we have evidence of both types. So very quickly, what you see is that there's very large variation in hookworm infection in the US at the end of the 19th century. And there was a mass deworming campaign initiated by Rockefeller at the turn of the 20th century. And the key point is this, that if deworming has an impact on education, you should see a much larger impact where there were more worms to begin with, right? And that's exactly what the study finds. So just one picture to show this. Right? So this is the variation in hookworm infection in the United States around 1900. And this variation is mostly due to variation in soil quality. And when this deworming campaign was administered across the board, what you find is that the biggest improvements in education happened in the areas that are marked red, which are the areas that had the highest worm intensity to begin with, right? So what that tells you is the historical evidence and the contemporary randomized evidence point to the same picture, which is that deworming has substantial impacts on learning outcomes. So Deworm the World, from whom we have representatives here. So the evidence suggests that attempts should be made to scale up deworming, particularly in schools for the reasons I talked about, the last mile problem and the infection problem. But the problem is that it sounds very obvious, But in practice, school-based health programs have been extremely difficult to implement in developing countries. And the reason is just a simple bureaucratic administrative one, is that it falls through the cracks between the health and the education ministry. So who owns the program? And health says, like, my job is to run the PHCs and CHCs. It's not my job to go into the schools. And the teacher says, it's my job to teach. It's not my job to fix the health of the kids. But the child doesn't care which sector he falls in. The child cares about child development. And this is a classic case where just thinking synergistically about something like this could have much higher returns. So in many ways, the impact of the deworming study, which is so surprising to educationists, is educationists think about the role of improving education within the box of the classroom and things that can be done there. But it might well be that something out of the box like deworming might have had much bigger impacts than anything you might have in fact done inside the classroom. Okay? So Deworm the World was founded in 2007 to provide technical and material support to governments to scale up universal programs. And in India, AP was a high priority state because worm prevalence data suggested high baseline worm load. Now, so this is kind of where we got to. Now, parallel to this, and if I had time, I'd spend a lot more time talking about this, but I'll do this very briefly, and I can talk to interested folks about this afterwards. But there's been a very, very ambitious and systematic research initiative in education that the government of Andhra Pradesh has put together over the past 5 years in partnership with the Azim Premji Foundation, the World Bank, and supported by DFID. And to conduct a series of randomized evaluations in education policy. And so in some sense, this is exactly to replicate some of those ideas in Kenya, where you were saying it's not just here's one policy that worked, but let's compare a whole menu of policy options that governments might consider to improve learning outcomes. So, policies studied under this initiative included performance-linked pay for teachers, provision of extra contract teachers, who have been a highly controversial policy, provision of school block grants, what happens if you just provide the schools with grants and let them spend it flexibly, provision of scholarships to students to exercise school choice, so can poor students take scholarships and go to private schools, and school health programs. So there's a whole many of these things, and that's not on the agenda, so I won't talk about it, but except to showcase this as what I consider best practice in terms of systematic partnership between government and research that is codified in a formal MOU. Okay? So scaling up with evaluation. So, based on the evidence we talked about, we still have a little problem, right? Which is, on one hand, evidence from these other contexts, Kenya and the US historical evidence, suggests that school-based deworming should be scaled up instantly, right? This is a quick win, let's go do it, right? On the other hand, there's relatively limited evidence of such impact in an Indian context. And so you could imagine somebody in India saying, this looks promising, but do I really want to go all out on this in an Indian context till I know that it's in fact having an effect? And it turns out that government of Andhra Pradesh again has established what I consider a best practice here of scaling up in some districts using DTW and using the evaluation infrastructure set up with the Premji Foundation to conduct an impact evaluation in parallel in other districts. And the key idea is that the evaluation districts will be covered in the last phase of the scale up. So you get large scale impact in the districts where you're rolling this out. You get administrative lessons, because in many ways the scale-up problems have less to do with the idea of the program than how you administer and scale. So you get administrative insights from scaling up at the district level. But at the same time, you learn about the impact from the randomized evaluations. And I think this is a model that could be relevant for many other programs. We're in conversation with a couple of other government programs right now about randomized evaluations over the life of the rollout. And I think this is a model that could be very fruitfully applied in a policy context. So just to give you a simple picture, DTW and GOAP started out in 6 districts in the first phase. They'll expand to another 12 districts. And the last 5 districts are the research districts. So this is where the impact evaluations have been going on for the past 5 years. And these districts will be covered in the last phase of the program rollout, so that you get 2 years of rigorous randomized evaluations within those districts on treatment and control on the impact of the program. So to summarize the session, it's that the global evidence in deworming suggests that it's a highly cost-effective way of improving health and education outcomes for children. DDW has helped GOAP in scaling up deworming programs. So it's not, so just one useful example of the kind of contribution DTW has made. So it turns out that it's important to actually do baseline assessments of worm load and actually measuring how much worms there are before you go in with the program. And now, that can be quite expensive, and so what GOAP has done is they have deputed the lab technicians from the PHCs to work in partnership with DTW to go conduct these worm assessments, and DTW has provided the technical support needed and the kits and the training required for them to be able to go do this assessment. DTW has provided training, they provided the pills, and they're basically working very closely in partnership with government, and including, for example,
trying to coordinate with other programs like the lymphatic filariasis program that also has albendazole in it. And I think in the end, the most important lesson here is what GOAP has done. And I think we're extremely grateful that Secretary Subramaniam is here, particularly because he was transferred from health to finance last week and had to leave budget meetings and come here for 2 days. So we're extremely grateful to him. And I would just pass this on to the Secretary, both to talk about the deworming per se, and more about the broader lessons that can be learned from the structured MOU and partnership that GOAP has set up to do this properly. So.